Thank you for giving me the floor. CanSupport arose from my personal experience as a cancer survivor and as a support person for people with cancer. I realized that almost 80% came to hospitals in India with advanced disease. Many are now coming with COVID and are being turned away because the hospitals are full. This is the case all over the world. I ask myself, where do desperately ill people with no resources go once treatments fail or there is no treatment at all? The answer is they go home to die a death of great suffering and indignity with no or inadequate support and care. CanSupport was created in 1996 as a donor-funded NGO to fill this gaping hole in public health. We were the first service to bring palliative care to the homes of patients in India, free of charge, and have been the flag bearers for home-based palliative care ever since. Beginning small, we are now the biggest palliative home care provider. At any one time, our service reaches 3,000 patients in Delhi and in the states of Haryana, Punjab, and Uttar Pradesh. We offer holistic, patient-centered care. Our professionally trained teams of doctors, nurses, counselors, and social workers work together with caregivers, the majority of whom are women, to relieve the physical suffering of those living with a life-limiting condition or disease, as well as address all emotional, spiritual, and economic concerns. Why home care? Evidence confirms something we all know. People are the happiest at home, in their communities. Most families still have a family member willing to nurse the ailing person. As care providers, we have an obligation to not only reduce the suffering of the person who has this illness or condition, but also to support families through difficult times. If we fail to do so, I fear the further breakup of the family and erosion of the glue that binds a community. The WHO Non-Communicable Diseases Division have reported that palliative care services have been significantly disrupted during the pandemic. A recent survey of our members has confirmed this downward trend, which significantly escalates serious health-related suffering. The International Association of Hospice and Palliative Care encourages member states to collaborate with national palliative care organizations as key informants as they develop policies and budgets to integrate services into national responses and preparedness planning. We remind member states of the joint statement issued on August 14th by the WHO, the International Narcotics Control Board, and the United Nations Office on Drugs and Crime regarding, quote, the ethical obligation of governments to ensure that their populations have adequate access to controlled essential medicines during the pandemic, unquote. Compassion is necessary, but not enough. It must be combined with the highest level of professional competence, which should be available to patients no matter who they are or where they live. CanSupport is ready to share its model with the relevant authorities to make this happen. The IAHPC and our members are standing by to collaborate with member states to integrate palliative care an essential service to relieve health-related suffering into their COVID-19 response. I thank you.